Asad Ahmed in Croydon. The mother of a boy who died from a fatal allergic reaction says she wants all children to have a better understanding of allergies. 13-year-old Karanbir Chima died from a severe reaction after cheese was flicked at him at school 2 years ago. She says schools and the government need to do more to ensure it doesn't happen to another family. Alpa Patel has been speaking to her.
Hey, okay, now I'm going to show you someone. This right here is my Nanaji, the best man in the whole world. And this is his grandson.
He was a very lively child. He loved life. He was always making videos. He was always smiling. He never let his circumstances get him down.
Karanbir Chima had multiple food allergies. In June 2017, a boy at school flicked cheese at him and it led to a severe allergic reaction.
I had a phone call at 11:33 saying Karan's touched something he's allergic to. Something said to me something's not right, by the way the girl spoke to me. I left work and I ran to school and he was on that paramedic table. That's the last time I saw him. I didn't even get to say goodbye. As you know, it's so important for everybody now to acknowledge life is so precious, because that morning I was late for work and I rushed down and I sort of said, don't be late home.
Karanbir died 10 days later at Great Ormond Street Hospital. The coroner said his school's healthcare provision had been inadequate. The inquest also heard that there had been a delay in giving him his EpiPen, and the one that was given was almost a year out of date.
It is the responsibility of the parent. Yes, but we send your child to school, so when he's in your care, you have better understanding of allergies and how to respond to them, how to react to them, how to understand them, understand the allergy. Understand it is not life-threatening unless you don't act.
Schools say they have guidelines in place. Do you think that they're sufficient, and if not, why not?
I think the evidence speaks for itself. My son's not here. That's why the evidence. And it's definitely not in place.
It's been over 2 years, hasn't it? How has life been for you?
There isn't. I just live day to day. I just live day to day. I've lost my best friend.
Rena would now like to meet the Education Secretary to bring about change. Her son would have turned 16 last month.
It cost me my son's life. It cost me my life. The world has lost a very happy, loving, caring person, selfless person, because nobody knew what they were doing.
Karanbir's mum talking there. Well, Twyford Church of England Academies Trust have said this: we are deeply sorry that we could not save Karan. We entirely agree with the coroner that there is a national lack of understanding over the use of EpiPens, and that there is a lack of clarity and consistency in the guidance provided to schools. It was not until a change of law in 2017 that schools were allowed to store spare EpiPens, and that they now do so. Schools need expert help in delivering education around anaphylaxis. Well, we can talk now to Professor Adam Fox, who works in paediatric allergy at Evelina London Children's Hospital. You are one of the leading experts in children's allergy, so thank you for coming in. We heard the statement there from the school saying more national guidance, and then we have this from the Department for Education, who we did ask a number of times to come in, but they haven't. But they sent this. They said, we are clear that children with medical conditions should be properly supported to enjoy a full education at safe at school. All schools are required to make arrangements that ensure this is the case. From your expertise, how do you reconcile the two?
It's difficult, isn't it? And what I see in my clinics is an enormous inconsistency in the experience of what pupils find when they go to school. We hear some really good stories about excellent practice where schools have really taken what we often refer to as a whole school approach, training staff, talking to the other kids about it, involving catering staff and taking parents seriously when they raise concerns. But then also we hear lots of pretty awful stories, and some parents are really seen as a nuisance when they're raising these issues, yet very clearly it's a really, really important issue. Parents need to know that when they send their kids to school that they're going to be safe, even if they've got medical conditions.
So is the onus on parents or on schools? Where is the boundary? Where is the balance?
I think there's responsibility on both sides. Obviously parents have a responsibility to make sure that they're letting the schools know exactly what the child needs, what they're allergic to, for example, but then there needs to be much more from schools, and it's difficult for them though, and unfortunately it's pretty clear that many schools want to do the best by the kids that they're looking after, but they're just not given the guidance that they need to be able to do that.
So what needs to change there then?
I think there needs to be more than just a statement saying that there's a statutory need to look after kids. What they need is much more clear guidance, collaboration with experts, with parents who have real experience at this, with the allergy charities, to come together with something that's really high quality so that they know exactly what they need to do and implement in schools.
Is there a bit of passing of the buck, if you like? I mean, that's probably putting it strongly, but, you know, who needs to do that?
There's potential for that, but at the end of the day, the people with the real responsibility are schools, and that leads to the Department of Education. So I think they really need to ensure that they're engaging with the right people to get the right advice in place.
And as I say, we did ask them to come in. Would you say that enough, you know, I don't like using the phrase, but, you know, lessons have been learnt since Karanbir's death?
There's so many tragic lessons that come out of every single anaphylaxis death. Thankfully, they're rare, but every time we hear about them, it's often the same messages that are coming out. That there's not enough understanding about the need for early use of adrenaline, so of things like EpiPens or Jex pens, that people don't recognise the severity of reactions as they're happening, or they're worried about using their adrenaline pens. And all of these things, really the remedy is education around it. And that needs to be, it needs to be the kids, it needs to be the parents, it needs to be the staff, it needs to be everybody involved.
And in the meantime, because sometimes these things inevitably just don't happen quick enough, as an expert in this, you know, what's your advice to any parents that are worried?
Well, I would always recommend that if you're concerned about what's going on in school, engage with them, speak to them, talk about what's happening there, but always push that message that if there's a concern about symptoms, that a reaction's happening, don't delay the administration of adrenaline. Get in there as early as possible, because it always works better the sooner it's given.
Okay, Professor Adam Cox, we really appreciate your time. Thank you for coming in.